I don't speak Greek, so I apologize. I can say a few words in Russian and other language, but not in Greek. And therefore, for those of you, if you need to collect, an interpretation tool, I think you can find it at the bottom of the room. Anyway, first of all, I would like to express my gratitude for the invitation on my own behalf, but also on behalf of the World Health Organization, which I represent here. I am responsible for an office that works on the prevention and control of non-communicable diseases. Non-communicable diseases is a very ugly and strange name. We're talking about diseases like cancer, cardiovascular diseases, diabetes, chronic respiratory diseases, mainly caused by tobacco, obesity, mental health, and others. These are responsible for a large burden of deaths and disability in the European region and beyond that. So my talk, my conversation today, first of all, it's a great pleasure, and particularly because I received an invitation from my old friend Antonia, Professor Tricopolo, which for us is a visionary in the science of in nutrition in Europe for many, many long years, and she has always been an inspiration and a fighter for traditional diets, and in particular for the Mediterranean diet, which I believe is a good thing to do. And I will try to explain why during my short presentation. I have many slides and a longer presentation than that. I only realize I have 15 minutes since I arrived here, but it's okay. I'll just run over some of the slides, trying to share our ideas. And basically, the first part of what I'm going to say is focus on the situation in the Mediterranean basin. So we all say good things about the Mediterranean diet, but it's important to ask ourselves if we are making good use of that Mediterranean diet in our own countries. And my answer is clearly no. We're doing worse than other countries in the region in many aspects, in the WHO European region, and we are not using the principles and the good things of the Mediterranean diet to the best we can. And that's really a very big problem. I have here. Okay, so this is our office. I work mostly in Moscow, although we commute between Moscow and Copenhagen. Moscow is part of, it's a branch of the WHO Regional Office for Europe, and there we have a large number of scientists and public health people working in the prevention and control of these diseases I talked to you about. We see it as the powerhouse, the innovation lab for NCDs in Europe. So basically, I would like to spend 1 or 2 minutes in the challenge. If you look at Europe, you really see a gradient. Red means it's more significant, so more people die prematurely in the eastern part of Europe, but also southeastern part of Europe, the Mediterranean area, sometimes is not doing as well as, some more western and eventually some northern parts of Europe. And if you go in terms of the detailed, like quality of life in the last 10 years of our life, which is becoming longer and longer in countries like my own, I'm from Portugal, or Greece, we have longer lives, but the quality in the last years is something that we need to look at. And here, we could do much better. So the European region, big differences, and the Mediterranean region, sort of in between there. So we develop in the context of the UN and the World Health Organization a series of targets approved by heads of state. We are not just talking about ministries of health. We're talking about heads of state in the context of the UN. They said we want to reduce premature mortality by 2025, 25%, and even more for the SDGs by 2030. And again, we have 9 targets. They are related, of course, with behaviors, alcohol, smoking, diet, physical activity, also some more medical, like, medication for NCDs and stuff like that. But you can see that you only have like 2 greens, meaning that on average, the European region will achieve those targets. But largely, although we do better than other regions globally, we could do much better. And some of the things that are keeping us, moving slowly is actually diet and physical activity. Because we are doing better in alcohol policies, we're smoking less and less, policies are improving there. In the areas of diet and physical activity, in many, many countries, we are lagging behind. So the picture is not too bad, but it could be much better. And everything starts very early. When we look at diet during pregnancy, when we look at, for example, breastfeeding in some countries of the European region, look for Greece. This is maybe not the last data, but you have many countries in the European region where exclusive breastfeeding, and Mediterranean countries where traditionally breastfeeding was important. It's a total disaster. So we are losing these traditions, we are losing this culture in a way. We are not using it for the maximum protection we could have. Look at the way we initiate our babies. We're all about processed foods, full of sugar. This is what we are initiating our small babies at 4, 5, 6 months. We are really not following these principles, This is a complex study we did. We looked at the amount of sugar in baby foods, all right? And here you can see huge variance. You have some baby foods with more than 30 grams of sugar. A school-age boy or girl, like age 8-year-old, cannot have more than 25 grams of sugar per day. Some of these foods, you gave it to a baby with 1 year old, which is 1 year old, and he already has more than 30 grams of sugar. This is not, my dear friends, the Mediterranean diet we all love. And this is really, to a large extent, the situation in the Mediterranean countries. We are looking at that. We have in our region the biggest surveillance system for childhood obesity, involving 40 countries. And you know what? You know what countries have the highest prevalence of childhood obesity? Our own countries. Greece, Portugal, Italy, Malta, Spain, you name it. So where is our Mediterranean diet? Another study in adolescents. Measuring data, highly comparable data countries. The columns here in the middle, the southern European countries. This is where the Mediterranean countries are. You see, we are the region from all the sub-regions in Europe, it's the one with higher obesity, and it's the one where it's really increasing as well. It's not even leveling off, except in a few countries. So my answer would be, I would argue that no, we are not using this to the full extent. In the context of the Mediterranean diet, not all is good. Our Mediterranean countries, we use too much salt from the old days, for our maritime traditions, all of that, But we are not moving fast enough compared to other countries. If you look at those countries highlighted there, these are the countries that in Europe are making progress in salt reduction. And you don't see Mediterranean countries there. So Mediterranean diet is very good, but not everything is excellent. And salt is something we need to reduce, but we are not moving that well. We are very resistant to better food labeling, front of pack labeling. You know where I see my resistance coming in? From people and my colleagues and friends in the Mediterranean basin. And I don't understand why. Because better labeling only protects Mediterranean foods. You are worried with olive oil. Olive oil is traditional. You can create exceptions. You can do a lot in terms of using better labeling. Better labeling favors Mediterranean diet. It's not against it. I saw a very famous, chocolate industry from a Mediterranean country using arguments around the Mediterranean diet, like if chocolate is part of the Mediterranean diet. I'm sorry, chocolate is not part of the Mediterranean diet. So why are you using this argument? Another problem is physical activity. We are not doing enough, Antonio talked about the traditions, and it's a way of life. We all know that. And physical activity was there in Crete when it was described by Ansel Keys and the others. And everywhere in the Mediterranean basin, physical activity was always a must. And again, unfortunately, our Mediterranean countries, they are some of the countries where we have lower levels of physical activity. So we really need to combine all of this. So I would argue that probably we are not using the benefits of our lovely Mediterranean diet to the largest extent, by no means. Again, so we were worried with this because we were like, in the context of WHO, you know, we are evidence-based. We use the science, we produce advice to ministers and governments. That's what we do. And everybody talks about the Mediterranean diet, but then we asked ourselves, but are we using these principles to define and devise and implement policies? And we didn't know, because this Mediterranean diet is even included in our policies, our food and nutrition guidance to member states. It's all there. But then we didn't know if countries are using it. So we've organized using a tool we call the Health Evidence Network, groups of scientists, you know, systematic literature reviews. So we looked at everything, not at the health benefits of the Mediterranean diet only, but mostly trying to understand if countries, especially the Mediterranean countries, are using these principles for policy making. And these are the main conclusions. So I can share the slides with you. And this is actually not published yet, so we will be publishing it probably in 1 month or so. So we reviewed a few types of evidence. I'm not going to go into the detail, just to let you know that we went over all the studies published in recent years in a very systematic and very concrete way. So we looked at, you know, national and subnational policies. We identified optimal evidence informed diets and interventions. You know, we sort of identified all the studies. We made a review based on all these principles. And then we sort of, from all these studies, we realized that yes, Mediterranean diet is very popular. It's even being captured by the media and by the medical science as well. Antonia already explained very nicely, we're talking about, you know, the olive growing area. It's not just the Mediterranean countries. I would strongly argue my country is a Mediterranean country. It has the Mediterranean diet, but we are not in the Mediterranean. But we are, I mean, if you go to the south of Portugal, it is a typical Mediterranean diet, the traditional one. So we consider ours, and our olive oil, I think, competes with the best olive oils in Greece as well. So we are there, certainly. So it's wider than most people would say. And therefore, it's even been used for medical reasons, and I think also for good reasons. I'm not going to describe it. It's well described elsewhere. It's plant-based, is environmentally, respects environment very nicely. It's based on fruit and vegetables. For example, there are many interpretations. In my own country, fish plays a stronger role than in other Mediterranean countries, and so on and so forth. So relatively well described. But you would see that many of those that argue in favor of the Mediterranean diet, they want to create confusion because you don't see their products described here. And I will give you more examples later on. Of course, the wine is an important one, and wine certainly is part of it, but wine as an alcoholic beverage, like my previous speaker very well pointed out, he said less is better. This is the WHO really advice. And it's the first time I hear someone working in the wine industry using this say less is better. It's very nice that you keep it at very low levels and in moderation. So the cultural aspects are also described elsewhere, the UNESCO acknowledgement and all of that, and the social part. We also describe that in our review, and it's very well described and identified there. So I strongly recommend that you read the review when it's out. Now, with the health benefits. So part of our publication is going to be summarizing the evidence in terms of the benefits. The benefits are all there. They are in a way overwhelming about cancer, diabetes, cardiovascular diseases, dementia eventually, even Alzheimer, and the very strong protective effects of the Mediterranean diet as they are described. So I think people that challenge the positive health benefits of the Mediterranean diet, they should be out of their minds because the evidence is very strong. Then we also looked at, are countries using these policies? Are countries using these principles? And certainly, so we actually compared the Mediterranean diet with something that countries in the north of Europe, especially Denmark and others now called the Nordic diet. That also has some very interesting features. And we see that, you know, countries in the Nordic world are actually organizing themselves better than the Mediterranean ones in terms of communicating the message, working together, putting it in, you know, in a systematic fashion, and introducing it into their policies. In the Mediterranean basin, we are not being, in general, capable at translating these positive effects into policy. And because this forum is very much into policies, I think that we would need to do much more there. And we have a list of recommendations in our paper where we are going to say the ways we see and the ways we think that governments could move forward in implementing these policies. So main message is there remains a region-wide need to increase translation of evidence into action, monitor and evaluate the impact of existing policies on NCD outcome, and share activities through public platforms to support information sharing. In other words, we are not using this to the maximum extent. We need to work more on our illustrations and the way we communicate the Mediterranean diet. I think it's very important. There are, you know, discrepancies there. We need to acknowledge and understand the different facets of the Mediterranean diet as part of its power, parts of its richness. You wouldn't expect that, I mean, Portugal, with its, you know, with its discoveries, traditions, and all of that, our diet would be exactly the same in south of Italy or in Greece or elsewhere. You know, there are several types of Mediterranean diets, and we have to acknowledge that and, you know, really to document and incorporate that into the policies. Being comprehensive is very important. We also need to acknowledge that there are other diets in parts of the world we can bridge across. You would be surprised that, for example, in Central Asia, countries we work with as well, to a large extent, there are some common features. So the traditional diets, as Antonio said very well, need to work more together, and this is just an example of markets, for example, in Central Asia, in this case in Kyrgyzstan. But these traditional diets, sometimes they are being hijacked by negative practices. In these countries in Central Asia, we found that, you know, in traditional foods, there's a lot of salt and trans fats, for example.
Senor Breda, you have 1 minute to conclude.
Yes, I'm really finishing. I'm getting there. We also, and my last word will be very much in terms, we also need to be careful that the Mediterranean diet belongs to the people. It does not belong to any corporation. This is a slide. Please don't take pictures, just to illustrate something from a foundation we call the Foundation of the Mediterranean Diet. It's full of companies supporting it that have nothing to do with the Mediterranean diet. The Mediterranean diet belongs to the people of the countries of the Mediterranean basin. It is okay to do business around the Mediterranean diet, but it's not okay that, you know, certain people try to hijack it and discredit the Mediterranean diet. We had some discredit we need to avoid. I think I would stop here. Positive word, but still a lot of work to do together. Thank you.